Arcadia TV. Thanks for tuning in. Today, in this episode, we have a special guest with us. We have a nurse, Miss Josie Tombrella. Thanks for joining us today, Josie.
Glad I could be here.
Yeah, so we'll just jump right in. So, Josie, if you don't mind, tell us a little about yourself. Now, I know you guys have been in the church for a couple years, and you guys actually recently joined. You've been visiting the church for a while, but I think a lot of people know you and David. A lot of people know your kids. So it's been a pleasure having you guys in our church. And I don't know if a lot of people know this or not, but you're a nurse. And so can you tell us a little about that experience?
Yes, so I've been a nurse, I guess, about 16 years now. I graduated from UTMB in Galveston, and I went back a few years later and got my master's degree and became a nurse practitioner. I'm a board-certified adult gerontology primary care nurse practitioner.
Now that's a title right there.
It's a lot
that's
to
amazing.
say there.
Yeah.
But I'm not currently practicing, but I teach down at UTMB in Galveston. I teach nurse practitioner students and help them get ready to go out into the field. So that's what I've been doing most recently since I had my kiddos. Before that, I worked in nursing homes and took care of the long-term care residents in the nursing facilities. So that's kind of my background.
Hey, that's great. Now you and David have 2 kids. How old are your kids?
They are 7 and 9. They have birthdays during the holidays, and it's crazy. So I always have to think, 7 and 9.
That's great. Yeah, same for our kids. They're Christmas, and actually the third child, I always get him mixed up with our younger one. So I'm calling him Weston already. So you know what? It doesn't matter as long as he looks at me. So
that's right.
Hey, that's great. Well, today we have Josie, and the reason why we have her on today's episode is because we actually wanted to talk a little about the virus itself, maybe from a medical perspective, and maybe some things like, hey, what can we do to keep clean or safe, or what happens if we start feeling sick? So just kind of from your perspective, can you tell us a little about the virus itself? Because I mean, this is a hot topic. I mean, everybody is constantly watching. My wife, myself, we're constantly checking the news. When I see someone cough, I'm suspicious. When I coughed, actually last week we went out and I was in a field of flowers. I started itching, watering, I started coughing, and my lungs felt like they were filling up, and I thought, this is it. I'm going to the doctor. I got home, started feeling better. So what do you know from your, just from your experience, from your medical knowledge about the virus itself?
It's really interesting, and my views have definitely changed over just in the past month. I know when I first started hearing about coronavirus, when it was still, pretty much overseas, I thought, it's the flu. It's like the flu. What's the big deal? But my viewpoint quickly changed as I realized how severe this is, and how the impact that it's made in our world thus far, and it's continuing. And I've watched it just move closer and closer to us, and now we found out yesterday it's in our community, and it probably has been, but now we know for sure it's in Santa Fe, and it's scary. And so definitely listen to all these recommendations and what everybody's telling you, and just stay home. Like I said, I'm not out in the field working, but I have dear close friends that are, and the healthcare workers, they're doing their best to keep it contained in the hospital, and we've got to do our part to keep it contained outside. And I read something interesting, on the internet this morning, and they, said the virus doesn't move, people move, and people are moving it. And if we stop moving, they'll stop it, And it's hard, because we're going stir crazy at home, but you just have to think. I mean, if we can just stop and keep this from being spread around, hopefully it will, go away. So.
That's a good point. I think a lot of people have probably felt the same way. Even I felt the same way when I first heard about it back in January or earlier. I remember even making a joke in staff meeting about it, and now it's, United States has the most cases now, and so it's kind of changed perspective just a little bit. So that's good. Well, let me ask you this: what are some ways, because we are moving, we have to move, we have to go to the grocery store. I think, in fact, I was talking to Erica this past week. I think it's almost impossible for us just to be completely still. Now she's starting her 7th week at home, because 2 weeks before the baby's been at home he's starting his 5th week, and so at home, and so she's like, I've got to get out. This is making me crazy. So we do have to get out a bit. We have to go to the store, get some supplies, or go to the gas station. What are some ways, some tips that we can keep clean or keep safe while we're out on the go?
Okay. Well, like they've been saying, definitely wash your hands, wash your hands, wash your hands. Soap and water's best, at least 20 seconds all over, knuckles, everything, wrists, just really good hand washing, super important. If you don't have soap and water, the alcohol-based hand sanitizers, at least 60%. Keep one of those in your pocket, and use that frequently. saw something about the virus being spread at gas pumps. I don't know if that's true. I don't know if they're swabbing gas pumps or not, but it's a good idea.
Right.
Those things that people are touching frequently, definitely, before and after, clean your hands. What else? Let's see. I saw something too, somebody recommended, keeping the little Ziploc baggies in your pocket, and that way you could use those, if you have to touch door handles or gas pumps. Put your hand in there, get your pump, your gas, and then throw it away and be done with that. Some people are wearing gloves, which that's fine if you have gloves, and you want to be protected that way. Just remember that when you're wearing gloves, whatever you're touching is contaminated, and so you don't want to touch your face with your gloves or touch your cell phone or dig in your purse while you're wearing your gloves, because
it's a good point.
People may not think about that, but you're spreading the germs around. So just if you do wear gloves, just touch your shopping cart, touch your groceries, but when you're done, take them off before you grab your cell phone or anything like that.
We were getting some food to go the other day, I think at P.F. Chang's or somewhere, and the lady had, she brought her food out with gloves, and I saw her taking them off as we were walking away, and she was chunking them in the trash. And it looked like she was grabbing some more, probably grabbing the next to go or curbside. Yeah, so those are really good points.
Yeah.
So I feel like I should have a fanny pack just full of supplies.
I think so too, and then when you grocery shop, a lot of, stores, if you have to go to the store, hopefully, there's good options for, not having to go, such as the curbside pickup or doing the delivery, grocery delivery. So definitely take advantage of those things if you can. I know HEB is a little backed up, but Walmart, I did an order yesterday for pickup today. So I think they're really trying to, keep people out of the store. So if you can do that, do that. But if you do have to go to the store, wipe your cart down. They have the wipes, and if they may not have them, so it might be a good idea if you have some at home. Again, put them in your fanny pack. Put a few in a Ziploc bag to take with you, so you can wipe your cart down. But they say it's interesting with this disease because we really don't know a lot about it. They're still finding things out. They thought it lived on plastic and metal surfaces for 3 days.
Yeah.
But then with a cruise ship, they found particles that were alive for 17 days after the passengers had left.
Oh my gosh. Yeah.
So I mean, that's crazy. So
wow.
Definitely wipe down those surfaces if you're out and about, and do your best to again, hand wash, hand sanitizer.
Yeah, that's great. Curbside service at the grocery stores is a great invention.
Oh yeah.
When this came out, we've been using this because we have the kids, and a lot of times it's hard to get them all in the basket, take them to the store, pick out something without having to buy them candy or toys. So we just do curbside, and so thank God for curbside. You're right. I think it was 24 hours. Really, I think when we made our Walmart order, the next day it was all day. Now they didn't have certain items, or they substituted certain items, and that was okay. But curbside is a really good thing. So, and hey, coming to Arcadia First Baptist near you is the new swag, the fanny packs with Arcadia logo. So those, be watching for those.
That'd be a good idea.
Yeah, that's great. So, well, let me ask you this. What do you do, say you start to feel sick? Like I said, we were on this trip and I started feeling, I was like, oh, this is it. I've got the corona. I'm going to be isolated from my family, which I'll probably get some work done. I'm just kidding. But when we do start feeling sick, I know there's probably a clear difference between sinuses, and we're, right now in allergy season. I mean, it's like Pollenville. And so what's the difference kind of between the sinuses, or what should you do if you start to feel sick? Even if it is sinuses, you should probably call the doctor, right? I feel like.
Right, yes. Most places that I know that UTMB clinics, they're not taking walk-ins anymore, so don't just show up at your doctor's office. You need to call first. If you do feel ill, definitely give them a call and let them tell you what to do. They can triage you over the phone. Telemedicine is amazing. That technology was kind of a new and up-and-coming thing, but it's really been pushed out to the forefront now with all this going on. And you can talk to your doctor, on a camera, not have to leave your home, and they can prescribe medication for you and do all that without you even leaving. So definitely, give them a call. If it's an emergency, obviously, you need to go to the hospital, but don't, just think, oh my gosh, this is it, I gotta go. Stay home, stay home with this, as long as you're not having trouble breathing, and just use your good judgment. It's scary, and you get a tickle in your throat and you think, okay, it's the corona, but it's probably allergies, because it's a terrible time for allergies right now. So definitely call your doctor before you go anywhere, and let them talk to you about your symptoms. And I know UTMB has a outdoor tent set up now for patients that if they're afraid they have the virus.
Oh, that's nice.
Yeah, so they don't even let you in the hospital. You have to be screened outside first, and then they develop a plan. So like I said, they're really trying to keep it contained, within the hospital and keep it from spreading around. So we've got to be really careful right now.
We with Miles, our youngest, our newborn, he when we took him to the appointment, they had to meet us outside, take temperature, do all the checks before they let him inside. So I feel like a lot of places are probably going to be doing that for a while. And hey, those are great tips. Stay home is probably the greatest tip.
Yes, stay home.
Hang out. And hey, I can't think of a time where we were asked to sit on the couch and watch TV. It's like, hey, you know what? Sign me up. You know, this is, So we'll save the world sitting at home, watch TV. So what, any other tips, any other thoughts on this before we close out our time?
One more thing I read this morning that I thought was really good about the virus, and it was, don't change your behavior to prevent infection, but change your behavior as if you're infected and you don't want to transmit it to others. So, you know, that might give you a new perspective on it and make you stay home, because what if you actually did have it? You don't want to go out unless you absolutely have to. So.
Yeah, that's really, really good advice. Thank you so much. Stay at home. Yep, that's the biggest advice. And hopefully this will pass over, because I know our people miss church.
Yes.
I miss the people.
Yes.
You know, when I get up here and preach or teach, it's just an empty crowd, and it's sad. And so hopefully that'll end soon. But Josie, thank you so much for your time. It's valuable, and your information, your knowledge. And I'm so glad that your family is a part of our church.
Thank you.
So you guys are a blessing to us. And so, hey, Arcadia TV, thank you for tuning in. And if you have questions, remember, you can always reach out to us. Check us out on our social media, Arcadia First Baptist. You can find us on social media, just about every branch of social media except TikTok. I still don't know what that is. But you can also go to arcadiafbc.org, and you'll find all the links, all the information there as well. So thank you guys for tuning in.